Good morning, everyone. This is Alex Harrington and Anthony Waters, and we are More Water Co. Chronic disease is the leading driver in the nation's $3.8 trillion in annual healthcare costs. Chronic disease is also responsible for over 60% of the deaths in Baltimore City, leading to a 20-year life expectancy gap between high-income and low-income neighborhoods. And healthcare costs in Baltimore City are 30 to 60% higher than the rest of the state of Maryland. COVID-19 has shed an even greater light on chronic disease impacts, especially in minority and underserved communities where health inequities are most prevalent. Current mainstream solutions to chronic disease are expensive, reactionary, and lack cultural relevance. In this picture, I'm standing on York Road in Northeast Baltimore City, not far from where I grew up. The strip I'm standing on houses 4 carryouts, 3 liquor stores, and 3 more convenience stores. No fresh foods, no places to exercise, just cigarettes, fried chicken, Hennessy, and lottery tickets. As Baltimore natives, Alex and I know all too well the impact of the disinvestment in Baltimore neighborhoods and the chronic conditions epidemic that followed as a result. All of my parents and grandparents have at least one chronic condition, and by my 27th birthday, I was also pre-hypertensive. Alex recently lost 4 family members to chronic disease. And in Baltimore, it's a common story. Plight, trauma, and food apartheid have left members of our neighborhoods to suffer from diabetes, heart disease, and stroke. But despite limited resources, our community has always created the spaces we needed to be, to live, and to thrive. And after going on to college to earn degrees in exercise and physical therapy, we realized that we had all the tools to come back to our neighborhoods and build a movement that would empower a community to take back their health. In 2019, I built the post-rehab exercise program at MedStar Good Samaritan Hospital in Northeast Baltimore. The program provided specific exercise programming for people affected by neurological conditions like stroke and Parkinson's disease, once they have been discharged from traditional physical therapy. Stroke and Parkinson's patients were able to improve the distance they could walk in 2 minutes, which is directly correlated to life expectancy. This led us to build More Water Co., where our mission is to reduce healthcare inequity and transform community well-being by using exercise to improve long-term health outcomes for people with chronic conditions. We provide evidence-based exercise as medicine programming and health coaching for people with chronic conditions such as diabetes, stroke, and hypertension. Our programming is community-centered with a focus on health equity, and we take the time to understand your individual barriers and enablers to a healthy lifestyle. In our primary research, we conducted 100 interviews with Baltimore community members. And we learned that community was the most commonly mentioned enabler to living a healthy life. People use community for accountability, support, and fellowship on their lifestyle journey. We also learned that exercise is scientifically proven to manage, treat, and even help to reverse some chronic conditions, independent of any other lifestyle or diet intervention. Exercise is most impactful when it is progressive, consistent, and applied correctly. We also know that exercise helps to save health system costs. According to the NCBI, exercise was superior to surgery and medication per dollar spent to improve quality of life regarding artery disease. And the American Journal of Medicine says that for each higher level fitness attained, there is an associated $5,000 cost savings for individuals with diabetes. So why don't we see exercise in healthcare settings? Well, gyms and other exercise facilities are not equipped to address chronic conditions, and many exercise professionals lack the medical experience to work with vulnerable populations. Physical therapy is usually the only opportunity for patients to receive exercise treatment in a healthcare setting, but physical therapy services are limited by time and insurance reimbursement and mainly focus on function rather than managing metabolic dysfunction. And that's where we come in. More Water Co.'s value proposition is that we improve a client's cardiometabolic health and physical function, leading to a reduction in the utilization of healthcare services and healthcare system costs. We engage communities that are often underserved by traditional healthcare approaches, And we improve overall community well-being by creating a space for our communities to get healthier together. We do this through our Movement is Medicine program. Now, during a typical patient journey, a patient will come in for an evaluation and then be given a wearable device that helps them to track program progress and fitness level. We will also track changes to cardiometabolic health measures like blood pressure and A1C. Patients are given access to unlimited group classes of up to 10 patients, and these classes are held Monday through Saturday. Patients will be able to also attend the classes virtually and have access to other healthy online content. Patients are also enrolled in our rewards program that incentivizes healthy behavior by rewarding patients for completing process goals. Reward may include anything from fitness journals to running sneakers, but rewards will always nudge patients toward more healthy behavior. And we will host mostly monthly workshops for patients in the larger community around topics that impact our health. Community is at the center of everything that we do. And it is the community that amplifies our impact. We often say that people come for the exercise, but they stay for the community. Here you can see some of the community work that we've done, from our running event collaborations with Run a Run to our blood pressure workshops and our Drink More Water apparel. In order for us to build community, partnership is extremely important. We work with churches, barbershops, to neighborhoods, associations, youth organizations, and universities to meet our communities where they are. We are strategically targeting partnerships in nutrition, transportation, mental health, insurance, and health systems to be sure that we provide all of the wraparound services needed for our members to be successful. Our first target market segment is our end user, patients with chronic conditions. We believe there are 83,000 plus Baltimore community members suffering from hypertension, diabetes, or stroke that are insured and are ready to get healthy. Our first customer segment are the 17 Maryland insurance payers who could see a savings of at least $5,000 per patient per year. A new focus on social determinants of health and population health models makes More Water Co. an ideal partner to help keep their most vulnerable patients healthy. The Health Service Cost Review Commission is the governing body that regulates reimbursement for all hospitals in the state of Maryland. Hospitals are penalized for not reaching benchmarks in utilization, readmissions, and cost containment. This is another example of the shift our healthcare system is making toward population health. Next, let's look at our competitors. The competitive matrix shows how More Water Co. has the ability to serve the broadest range of patients along socioeconomic and tech-driven spectrum. As you can see in this competition slide, there are very few organizations out there who use exercise programming as their primary medium to achieve better health outcomes. However, there are several tech-driven apps companies that have had success improving outcomes and generating cost savings. However, these chronic disease management apps fail to reach communities who face the largest health disparities and help to lead to further health inequity. Our community-centered approach not only helps us to reach those communities, but also to help drive healthy lifestyle change. The International Journal of Environmental Research says that social support and community is one of the main factors to maintaining a healthy lifestyle. Our revenue model is based on monthly subscriptions paid by an insurance payer on behalf of the patient. Patients has to commit to being in the program for at least 12 months. Payers pay $200 a month in the first year and $150 a month for patients still enrolled after year one. Patients can also elect to self-pay for membership services. We are seeking an insurance or health system partner to pay for 100 patients to participate in our program in year one. The deliberate pace of our ramp up will help us to prove efficacy of our program. Efficacy data from year one will be used to increase patient referrals and attract new partners. After gathering efficacy data, we plan to expand memberships to 288 patients in 2023, which will allow us to break even and start to generate profit by the end of the year. In 2024, we plan to hire another exercise clinician, allowing us to treat 428 patients and generate $111,000 in net profit. Due to our slow ramp-up phase, we will not have enough patients enrolled in the program in year one to cover operational costs and CapEx expenditures. We expect to have a deficit of around $208,000 in year one. However, there's a clear path to profitability in the subsequent years to follow. Here's a breakdown of our itemized expenses in year one based on the minimum staff and infrastructure needed to execute programming successfully. Baltimore continues to suffer through higher than average morbidity and death due to repeated failures to prevent and treat chronic conditions and address health inequity. The peer-reviewed evidence is clear. Exercise is cost-effective and the knowledge is abundant. The will is there. It's only the support that remains. We seek $208,000 in grants to offset our year one operational deficits from our program validation stage. We seek to lease, borrow, or share 3,500 square feet of dedicated space in Oliver Broadway, Hollins Market, or the Winston-Hiller neighborhoods. And lastly, we seek a strategic partner to refer and pay for 100 patients to participate in year one. Thank you. We'd love to hear from you. Do you have any questions?